Hello, I'm Dr. Frances Pitsillis. Pain is the most common reason people go to the doctor, and it's a huge topic. I could talk a book to you about it, but today I'm going to try and cover polymyalgia rheumatica, fibromyalgia, thyroid, vitamin D, and drugs. So we'll see how we go. Polymyalgia is most common in older women, and you may know an older relative who's had it, and often they've been on steroids for many months or years, and their bones have crumbled because of the steroids. Now, the symptoms that they had were mainly around the shoulder girdle, but sometimes around the hip girdle, and stiffness and not being able to get in and out of a chair. Interestingly though, these symptoms can be similar in other conditions, including an underactive thyroid. The other conditions on top of that can include a local problem, arthritis, rheumatic conditions, viruses, and even cancer. So it's very important to make sure that problems are not missed, and going to an integrated or personalised medicine doctor will enable this person to be supported while they're on the steroids and even come off the steroids more quickly so that their bones don't suffer and that their bones are protected. Now, in my own experience, people come along thinking that they've got polymyalgia rheumatica, but they've really got an underactive thyroid. And this can also happen in a situation where someone's been diagnosed with fibromyalgia. Now, fibromyalgia is a syndrome of unknown cause. Now, a syndrome is really a collection of symptoms. It's where doctors have not been able to really get a specific diagnosis for the cause of that person's collection of symptoms, and that's why they call it a syndrome. And in the case of fibromyalgia syndrome, it is defined by the American College of Rheumatology as being diffuse soft tissue pain lasting at least 3 months, and also the person has at least 11 out of 18 specific pressure points around their body. These symptoms are worsened by stress, exertion, lack of sleep, and weather changes. 6% of people can have this, so it's quite common. And as I mentioned, it's more common in women as they age. Now, experts say that you should make this a diagnosis of exclusion. That means you've got to rule out that there isn't anything else wrong with them, that there isn't something serious causing this, and that's always very important. But what's interesting about fibromyalgia is that it tends to also run along with chronic pain. In fact, there seems to be a spectrum of pain across to fatigue and fatigue across to pain. And often fibromyalgia patients have fatigue and chronic pain patients have fibromyalgia. And a percentage of these people, as part of their problem, have got an underactive thyroid. Now, I want to tell you about the case of Susie, who's age 23. I was introduced to her socially by her mother, who's a friend of mine, and her mother gravely told me that Susie has fibromyalgia. She's been under a lot of stress lately, and she's been doing her university exams. Now, a few weeks later, the mother brought Susie to me, and I could see very obviously on examining her that she had very obvious signs of an underactive thyroid. I treated her thyroid, and within a few weeks her mother told me that Susie was gaining her energy and was starting to feel normal again. So that's a very important thing to remember about fibromyalgia, that there could be a thyroid problem involved. Isn't it interesting that often women get this as they get older and after menopause, but they also get underactive thyroid as they get older? So it's very interesting. I want to tell you about another case, but this time it's vitamin D deficiency. Rita, age 63, has Samoan and Chinese blood in her, so she's got relatively dark skin and she works indoors. So she doesn't get a lot of sun, but people with darker skin need a lot more sun to get vitamin D. And she came along with diffuse body pain. And it was all through her back, in her neck, and shoulders, but she had a lot of vague pain and couldn't specifically identify its nature and what it really was. However, it was bad enough that she couldn't turn over in bed without the pain waking her. I found her to have the lowest vitamin D level I'd ever seen. Within a week of me giving her a loading dose, a fast-track dose of vitamin D to help her, she emailed me and she said her pains have all gone and now she could go to the shopping mall, because before she used to have to hold on to things to stop her falling over. So her pain was improved, and vitamin D also reduces sway. So that's an interesting point, especially in older people. It might help to prevent falls. Now, vitamin D is another one of these hidden conditions that chronic illness patients come to me about, and I always test their vitamin D because I've found 9 out of 10 of them have a low vitamin D level, and if it's very low, treating it often gives me dramatic results. What I've also found is that these conditions, mainly fibromyalgia, vitamin D deficiency, and in a moment, hormonal causes of body pain, are often associated with a whole range of other conditions, including tension headache, irritable bowel, migraine, other pain conditions, restless legs, depression, anxiety, problems sleeping, memory, concentration, etc. So I've got to sort of approach the whole thing from the bottom up, as I've already mentioned, but I've mentioned to you a couple of important things to treat in these conditions. When it comes to hormones, often you'll talk to somebody and they'll say, I feel stiff getting up in the morning. And for me, that's an alert. I have to look at their age group, and I have to think about whether it's thyroid, lack of estrogen if the woman's getting older, or lack of testosterone. So hormones as a general group are important in terms of looking at these types of body pains where there's morning stiffness and then once they get going, they're okay. Finally, I think it's important to look at the drugs and medications that someone's on when you're looking at pain. I don't think most of them do actually create pain, but I do know of one group, and that's the statin drugs. Now, it is important that if you have heart disease or documented atherosclerosis, you must take your statin drug. However, if you are on a statin drug and you have pain, then you need to be aware of that. It can cause pain anywhere, but people often report to me that it tends to be in the back of the calves. It might be as simple as stopping it if you don't really need it, or adding in coenzyme Q10 to help you with this problem. So whenever someone comes to me in pain, I like to make sure it's not a drug. I look at all the areas. I make sure a serious diagnosis hasn't been missed. I think of whether it could be thyroid. I actually think about magnesium as well, particularly in the situation of leg cramp. I think about hormones. And generally, unless the patient has a specific rheumatic condition that requires drugs, I try to avoid them.